Arthroplasty, knee, tibial plateau. With debridement and partial synovectomy, the physician replaces the damaged or degenerated tibial portion of the knee joint. The physician makes a medial incision along the patella. Dissection exposes the knee joint and tibial plateau. The menisci and anterior cruciate ligament are removed. The physician may also need to release other soft tissues around the knee to correct contractures and restore range of motion. The physician makes a bone cut through the tibial plateau using a cutting alignment jig. Peg holes are made on the remaining tibial plateau and the tibial component is placed into position. Screws and/or glue secure the component. The incision is repaired in layers with sutures, staples, and/or stri strips. If the synovium around the knee joint is diseased, the physician may remove it as well. Arthroplasty, knee, hinge prosthesis, e.g., Waldius type. The physician incision directly over the knee. Bone cuts are made to resect the anterior and posterior femoral condyles. A tibial cutting guide is used to remove a minimal amount of bone from the proximal tibia. A template is placed on the cut tibial surface and an osteotome is used to remove a square of bone from the tibial surface as outlined by the hole in the tibial template. The stem of the tibial component is placed into the hole and the femoral component is placed on the distal femur. Two polyethylene bushings are inserted into the femoral component and joined to the tibial component with the metal axle. The patellar component is applied by making a cut along the articular surface, making a peg hole, and inserting the component. If the patella does not track properly, a separately reportable lateral retinacular release is performed. All components are cemented into place. The joint is irrigated. The incision is closed in layers and placement of temporary suction drainage tubes. Arthroplasty, knee, condyle, and plateau, medial or lateral compartment. The physician replaces one diseased or damaged compartment of the knee, including the femoral condyle and tibial plateau on the same side. A medial incision is made along the patella and dissection exposes the knee joint. The physician prepares the selected compartment for arthroplasty by removing the meniscus. Other soft tissue around the compartment may also need to be released. Using a cutting alignment jig, the physician makes bone cuts on the femoral condyle and tibial plateau of the compartment being replaced. The other compartment is left intact. Peg holes are made into the bone and the femoral and tibial components are placed into position. The components are secured with screws and/or glue. The incision is repaired in layers with sutures, staples, and/or stri strips. Arthroplasty, knee, condyle, and plateau, medial and lateral compartments with or without patella resurfacing, total knee replacement. The physician replaces severely damaged or worn cartilage of the knee joint. A midline incision is made over the knee. Dissection exposes the knee joint. The physician may release soft tissues and/or ligaments in order to correct deformities and improve range of motion. The physician uses a cutting alignment jig placed on the upper tibia to remove the tibial joint surface, both medial and lateral compartments, by making a bone cut. A cutting alignment jig is also used on the femoral condyles to make the appropriate bone cut. Depending on the integrity of the joint surface of the patella, the physician may also make a bone cut to remove damaged cartilage. If the joint surface is healthy, it is left intact. Peg holes are usually made, and the components of the prosthesis are placed into position on the tibia, femur, and, if needed, the patella. The components are secured with glue and/or bone screws. The incision is repaired in layers with sutures, staples, and/or stri strips. Revision of total knee arthroplasty, with or without allograft, 1 component. Femoral and entire tibial component. The physician performs a revision of a total knee arthroplasty. Typically, previous skin incisions are incorporated to expose the knee. One or both, femoral and tibial, components are removed as determined by the physician. In order to remove the components, an osteotome or saw may be used to loosen the cement or bones so that the prosthesis can be topped out with a mallet. If any cement is present, it is removed in order to protect and preserve as much bone as possible. Bone cuts are made to accommodate the new prosthesis. If significant bone defects are present on the femur, tibia, or both, a bone graft may be needed. An allograft, donor bone, may be packed into the defect. The components of the new prosthesis are placed into position and may be cemented for fixation. The femoral and tibial component are revised Indiana 27487. The incision is repaired with sutures, staples, and slash or stri strips.